So should you give activated charcoal to people that have taken overdoses of tricyclic antidepressants? Well, I hope you like old and outdated evidence because you're about to get 5 papers of it. First one is Crome in 1983 that looked at 48 patients and found no benefit to giving charcoal. Second one was Hulton in 1988. He looked at 91 patients. They did gastric lavage on all and found that people that got lavage and charcoal didn't do any better than the people that got gastric lavage alone. Then there was Boss in 1995 who compared charcoal or gastric lavage on 51 patients and found no significant differences. So far, so bad. Doesn't sound like it's working. But there are a couple of older papers, one by Crome, one of the previous authors, in 1977, who found that charcoal reduces the absorption of nortriptyline. But in this paper, he gave the charcoal within 30 minutes of ingestion. So not a common scenario that we get to apply in clinical practice. And then Schwartz in 1984 found that if you give charcoal anytime up to 4 hours, then the concentration of the tricyclic antidepressant in overdose will be reduced. This was done with repeated doses of activated charcoal given via NG tube. So the recommendations on the therapeutic guidelines are that if someone's taken more than 5 milligrams per kilo of tricyclic antidepressants, you give them charcoal, providing they're alert, awake, and protecting their airway. And you do this anytime up to 2 hours after ingestion. The evidence is overall quite poor in quality, and it's a bit controversial about whether charcoal actually helps. Charcoal absorbs tricyclic antidepressants. It's just not clear whether that has a clinical benefit.